the actual process of delivering care should be built around each individual patient that encounters or comes into contact with our organization.
Hello, welcome to the Better Outcomes Show, where we explore the possibilities of a new healthcare. Each episode, we bring you a conversation with leaders across the healthcare industry, exploring topics ranging from new treatment techniques and interventions to novel service delivery methods and business models. And now your host, Rafi Salazar from Rehab Practice Solutions, a leader in patient engagement and retention strategy. Let's explore the possibilities of a new healthcare.
Well, hello again. Welcome to another episode of the Better Outcomes Show. I'm your host, Rafi Salazar from Rehab Practice Solutions. Just a little note before we dive in, we are running a promotion, trying to get the word out for the second launch, if you would, of the book, Better Outcomes, A Guide to Humanizing Healthcare, now that it's available on Audible. So what we're doing is we're giving you a special offer. If you buy the book, either on Amazon or Audible, shoot us a screenshot of the receipt or, congratulations, you bought the book. We will give you access to our direct-to-consumer marketing in healthcare course. It's called Bottom-Up Marketing, Direct-to-Consumer Marketing in Healthcare. We normally sell this for around $800, but if you send us a copy of or a screenshot of your receipt to either Audible or Amazon, we will send you a code for that absolutely free. If you've already purchased the book and you still want in on this offer, just leave us a review on Amazon and send us a screenshot of that, and we will shoot over the code and you'll get free access to the course. I want to say there's like 8 or 9 videos that we did, presentations all about setting up the positioning, what the funnels look like, the process for converting leads to plans of care or to scheduled appointments, and then some of the back end stuff as well, like how do you engage them, how do you make sure they're going to show up, these patients that you've now attracted through your marketing. So I think it's worth it, but I might be a little biased. So if you want to do that, just shoot an email to info@rehabpracticesolutions.com with a screenshot of either the receipt from Audible or Amazon, or a screenshot of the review you left us, and we will we'll send you over the code. Okay, this week we are going to talk a little bit about patient engagement, primarily what can clinicians and clinical organizations do to improve patient engagement, primarily using things like technology platforms and the like. I think there's, in the book, Better Outcomes, A Guide to Humanizing Healthcare, I spent a good bit. One of the whole chapters is focusing on patient engagement and what does that mean and how do we get patients actively engaged in their care as opposed to being passive recipients of their care. So I'm going to talk a little bit about this. So I don't have an interview lined up for you. We've got a few coming down the pike, which are going to be really interesting. But right now you're stuck with me. So sorry if that makes you sad. So when I think about patient engagement, primarily the idea of how do we improve or how do we get patients to take an active role or become active participants in their care, whether that be care planning, so the planning of the course of care they're going to receive, setting the goals, setting the benchmarks, what are ideal outcomes, all of that, to actively or actually doing their part. So whether that be, I'm from the physical therapy space, whether that's completing their exercises at home, maybe it's some kind of wound care, maybe it's some sort of edema management, if it's something like chronic conditions like diabetes or heart issues, cardiac issues, how do we get the patients from being somebody that just sits in the exam room saying yes, 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 getting the information, and saying, okay, will you take care of it, to being an active participant or taking an active role in that, where they're proactively looking for strategies or looking for things to help improve their overall health and quality of life. I want to say, back when I addressed this in the book, we really talked about the non-human or the non-technical piece of this, empathy, active listening, building a relationship, and then leveraging that relationship on behalf of your clients and patients to get them to become active participants in their care. And I think that's still very relevant, very important. Research hasn't changed on that. So the question is, well, how do we do that? Like, how do we actually make that connection, make that relationship, and then leverage it on their behalf? And I think this is where something like technology or using some sort of system to bypass some of the abstracting that takes place in healthcare can be very useful. So I'm thinking primarily around access in this case. So again, two main things in my mind here to improve patient engagement, to make patients become active participants in their healthcare involve really, in my mind, two main components. One component we've talked a lot about, we'll kind of touch it at the end of this little episode, is just the human relationship side of things, the active listening, the empathy, that sort of thing. So human relationship, boom. And the other main one is access. And what I mean by access is not that the patient can get an appointment, not even that the patient is able to afford the services. Of course, that's important as well. I mean primarily the access that the patient has with that clinician or through that clinical organization. So you've probably experienced this. I know I experience it just about every time that I need to either book an appointment for myself or one of my children. And you call the provider's office and it's a phone tree, right? Right? It's like, press 1 to be connected to so-and-so, press 2 to be connected to XYZ for billing or to schedule an appointment. You click 2, hoping to schedule an appointment, and it takes you to another phone tree or another series of things that you have to listen to, options. Some of that just is par for the course when you have big healthcare organizations. But anything we can do to decrease that bureaucratic mess that usually puts blocks between the clinician and the patient, or the patient and the clinician, really helps build that relationship, which we'll get to at the tail end. So how do we get to that relationship? We need to make the relationship accessible. We need to make it easy, or at least decrease the perception of difficulty on the part of the patients to develop that relationship. So maybe it's some sort of direct line of communication that can be established, whether it's through like a patient portal or secure messaging or something of that nature, maybe asynchronous video communications. A while back we had Susanna from AC Health on the podcast, and she talked her whole business is asynchronous video communications in the physical therapy space between physical therapists and their patients. So when you think about, well, what might be one of the things that is difficult in the relationship between physical therapists and patients, and what might keep the patients from becoming actively engaged in their own care, one of the big things is, for example, I don't know how to do this exercise, or this exercise hurts when I move in this direction. Is my form right? All these little questions. And instead of, having an easy way to get that question answered, most patients just stop doing it until they show up to their next appointment, or maybe they have to cancel an appointment or something happens, and then it ends up being 2 to 3 weeks. They show up, the physical therapist says, okay, so how are you doing on your exercises? Let's take a look. And they say, oh, well, I haven't done them. Well, why haven't you done them? Well, because I didn't know it was hurting a little bit here, or I just didn't know if I was doing it right, so I figured I'd wait to see you. And now this patient has lost, 2 weeks or a week of their potential recovery time because they just didn't know. So her platform allows the patient to take a quick video of themselves and send it to the physical therapist. The physical therapist can then look at it on their own time. It doesn't need to be heads up or synchronous. And can shoot a response over very quickly, whether it be through video or through text. Something like that removes that barrier. And what that removal of that barrier does, it actually does two things. One, the very practical, it gives the patient the answer they need. It gives them the information they need so that they can continue to complete and become active participants in their home program. But then it also increases and improves the relationship now that that clinician has with the patient, and vice versa. The patient feels like, okay, I sent this message to the clinician responded to me, I didn't have to go through a calls tree, or I didn't have to, there wasn't this whole layer of mediation between me and the clinician. I had a question, I sent my question, and I got a response. Now, it doesn't have to be something that complex. If you don't want to do the video thing, you don't have to. That's just a good example. Something that's very easy and that most healthcare clinics have or should have is just something as simple as like secure messaging through a patient portal or something like that, where the patient is able to send a quick note over, and maybe it's getting triaged by a nurse or by a support staff. But then the patient is then able to receive a response from either the nurse or the clinician themselves. And again, what that does is it removes the barrier, or at least the perceived barrier, between the patient and the clinician, and it helps facilitate that relationship a little better. A lot of times those phone trees which we set up, their intention, or the intention is not to abstract it or to make it more difficult to communicate between the clinician and the patient, but a lot of time that's how it's perceived. Like, I got to call, I got to do this phone tree, I've got to do X, Y, Z. And maybe it was set up that way to be more quote unquote efficient. It was supposed to streamline the calls that come into the organization, sending people to the right person so that you are talking to the right person. And some of that, I get it, is important, and you need it. You can't just be swamped with a bunch of general calls and then having to field them and send them wherever they need to go. But for things that involve, patient information, patient education, patient questions specifically about their care, that sort of communication needs to be treated and handled different than somebody calling with a question about their bill, or a question about maybe an appointment coming up and the paperwork they need to fill out, or something like that, or I've got a question about how to schedule an appointment, or something where it's more administrative. It doesn't really need the input of a clinician, or it doesn't really pertain to that course of care or that direct relationship. Sure, put those in a phone tree. I mean, obviously try to make that as streamlined as possible, because you're thinking about the life cycle, the patient relationship life cycle. You want that the touch points to be very positive encounters every time, for sure. So don't go make it a bureaucratic mess to schedule an appointment, but then super easy to message your clinician. But specifically with that patient-clinician communication, we want to do as much as we can to remove, like I said, it might even be perceived barriers on the patient side. Sometimes even just knowing, even if it's 2 buttons that they've got to push, they call the clinic, press 1 to leave a voicemail with your physician or your clinician, like, even that is a barrier. Removing friction points is the key. So if that's a really big barrier, perceived barrier on the part of your patient, something as simple as, well, shoot us a text message or send us a message in the portal can be just as easy, or can be easier, especially if it's like on an app on their phone or something like that, where they can log in. Maybe they just fingerprint their way in and then text message or send a little text over to the clinician, and it goes into an inbox. And like I said, it doesn't mean that we're putting more work on the clinicians, because those messages can be triaged by a nurse or by a support staff, by someone who can kind of filter through, okay, this is something that needs a response now. This is something that can be handled by a nurse or a support staff. This is just a procedural question or something like that. But then if there is something like a specific question about, we're going to go with the exercises here, like a specific movement in an exercise or specific pain that a patient might be having with a certain activity, then that can be addressed by a clinician. And it doesn't need to be addressed right then and there. It can be addressed, in the lull time, if you would, during that normal admin time where the patients or the clinicians are normally calling patients back or leaving messages. Sometimes the text message feature, the secure messaging feature, can actually be quicker and save clinicians time, and it increases the perceived access. So I own a physical therapy clinic myself, and we do this in our courses of care with our patients that come through the clinic, is that we've got a secure messaging feature. They're able to shoot messages to and from the clinicians And the clinicians that do this, or the patients that do it with the clinicians, one, the patients love it because they know that they can talk to, Rafi or, any other member of the team. They can shoot them a message, and they might not get a message back right away, but they will get a message, and it'll be directly from us. The clinicians love it because they're not having to play phone tag with patients. They're not having to, track them down and actually spend time on a call. They're able to look at the message or the question and respond very quickly and efficiently. So a lot of times it's in a let's say in between two patients, or in a time where there isn't enough physical time to make a phone call and to play phone tag or leave a message. That takes 5 to 7 minutes or whatever. And the clinician, if they're using the portal, they're already in the CRM or the EMR, however it works at your clinic. They're already in that portal anyways, doing their daily work. They see the little notification. They can click on it and be like, oh, Mr. Smith has a question about XYZ. Boom, pop it in there, answer a question, send it off to them, and they're fine. And sometimes that can take 2 or 3 minutes, so half the time, give or take. So it is one of those things that on the surface might seem like it's going to be a big overwhelm for the clinicians. Maybe they're going to get swamped with messages, yada, yada, yada. And that might happen to some extent, at least in the initial phases while you're developing your process for doing this, for handling it, for incorporating this sort of messaging feature into your workflows. But once you get it down, it's more efficient. It increases the access, which is the big thing, right? It removes that barrier, the perceived barrier between the clinician and the patient. And then it improves and fosters that relationship. So moving into the relationship, well, how do you do that? I spent a whole chapter on the book, Better Outcomes, A Guide to Humanizing Healthcare, on that. You can find that book on Amazon and Audible, plug for the book there, or you can go to book.betteroutcomes.show. And we've got links there to where you can buy the book. So empathy and active listening here is the key. In the book, we talk about building meaningful relationships, and that kind of filters into the patient engagement piece. But the idea here is that we want to improve, obviously, the interpersonal skills and the abilities of the clinicians and the team members in order, or with the focus of building meaningful relationships with each patient that comes into the organization that are built on this sense of mutual trust, empathy, and care. So, it goes really without saying that at the very least, patients expect to be treated by clinicians who are professional, competent, etc. Right? Like I used to tell this to students when I was a professor at the university, and I tell it now to students that come through our clinic here for clinical rotations, and really when I'm working with clients in general, like competency is the baseline. You don't win any points for being a competent clinician. That is part of what is expected of you in your job or in your role. What is above and beyond, and what adds to and makes you more effective as a clinician or a clinical organization, is your ability to communicate effectively, to build trust with your patients, to build relationships with those patients, and then use those relationships to help get them from where they are now, whether that's painful in the world of physical therapy, dysfunctional, immobile or something like that, or dealing with a chronic disorder or chronic pain or chronic diagnosis, and getting them to their desired future state, for lack of a better word. But what does success look for this patient? The idea here is that you're leveraging your skills, your interpersonal skills, to help the patient get there, whether it be becoming pain-free, getting to the baseball in the backyard with the grandson, or managing their diabetes more effectively and getting off medication, or whatever it happens to be. So basically what we want to do is remember that healthcare is a human experience, right? It's a human encounter. It's one person skilled in the art of healing, that's you or your clinical team, helping another person on their unique road to recovery. I say that a lot, but it's so true. So we spent the first half of this episode talking about ways to remove the perceived barriers between clinicians and patients and vice versa, in order to facilitate this relationship. And the best clinicians, those that are sought out by patients, by other referral sources and referral partners, are those that are able to make that human connection felt. And to do that, we need to just be intentional about, one, the way we set up the process of care. I'm not going to talk about that now because that is an entire podcast episode in and of itself. But the main way that we do that is through the actual encounters, the interactions that take place in the clinic between the patients and the clinicians. Ultimately, the aim should be to communicate to the patients an attitude, if you would, of care, empathy, and sincerity. And you want the patients to know that you don't just, they're not just a number on a checklist for you. They're not an item on the to-do list, or even worse, like 4 billable units in the world of PT. But you want the patient to know that you see them as a real person experiencing a real limitation or dysfunction or pain. And you do that by cultivating this environment of safety, trust, and collaboration. Now, part of that is what we talked about in the earlier segment of this episode. So removing those barriers, because if the barriers aren't there, there's less of a hindrance, and you've removed the thing, if you would, whether it be a phone tree or your bureaucratic mess, the difficulty of communication. So once you've streamlined the communication, you've opened it up. That's great. That's part one. Part two is then how you communicate. And how we communicate should be in a way that involves actively listening to their needs, showing empathy, whether it be through those reflective statements that you use to let the patient know that you're listening to them, that you understand, that you're processing, and that you're using that information to inform the recommendations that you're making or the plan of care that you develop with these patients. It's funny, doing the research for the book, when I was writing it, it's funny to see how important this is and how little it gets, at least when I was going through school, gets talked about. They talked about, or I was taught a lot about, the importance of the therapeutic alliance, the therapeutic relationship, developing trust with your patients, but it was very high level, and there was no okay, well, what happens if you have a patient with XYZ diagnosis under these circumstances and there's a barrier there? I feel like at my time at the university when I was a professor there, and even now, as a clinic owner or somebody that's got students coming into the organization, we focus a lot about this now in the practical sense. And when I was a professor, we had moved more towards case-based learning, which was awesome. It was a great way to do business or to teach those skills. And there was more of an increasing focus on actual interpersonal interactions, and it was easier to do it in a case-based environment where you could do role play, where you could have situations where maybe a student is getting not put on the spot, but they're actually live role playing with each other and with the professors, to put them in situations where, okay, it's one thing to say we're going to listen with empathy, but what about in this circumstance where you've got a patient maybe with a totally different life experience than you, maybe they come from a different cultural background, different cultural perspective, and this is what they say. They say X, Y, Z. How do you respond to it? Again, it's one of those things that it sounds good. Oh yeah, we need to be empathetic. We need to practice active listening. But until you've got a patient who is in there saying something like, I don't think you're going to help me. I don't think you're going to be able to help because, I've already seen 5 other clinicians and no one's been able to help me. Until you've been in that situation as a clinician or as a person, you don't really know how you're going to respond. You can practice, but it takes actual experience doing this. So whether that be with each other in the school setting, that kind of preps you for that. But then as you go into the world, as you go into the clinical world, actually doing that, taking the time to actively listen, even if you're going to get it wrong. There have been multiple times in my own clinical career where I've said to a patient, listen, I'll be honest with you, I don't really know. I'm going to do my best, and this is what I'm going to tell you. This is what I'm going to promise to you, or to commit to you, that I will do my very best as a clinician to help you get from whatever the goal was, from X to Y. And I might not have all the answers, But I'm going to get you either in contact with the right people to help get you there, or I will do everything in my power to make sure that I can help you get to your desired goal, whatever that happens to be. A lot of my work was with patients experiencing chronic pain. When I was at the VA, we were able to develop an interdisciplinary pain management program, and a lot of those times patients would come in and they had multiple comorbidities of generally in the mental health space, obviously, combat veterans. So there were plenty of times where a patient would come in and, I would do my evaluation with them and I would say, you know what, I can definitely help you with whatever it is, your shoulder, your back, your neck. The reality is though, that it's not just going to be me. There's going to need to be a team because what you've got going on is it's complex. And I know that you've probably seen a few different clinicians and you feel hopeless about, you might feel hopeless about your ability to recover. But what I can promise you is that I'm going to do my part on the piece that I can help you with right now in the clinic. But then what I'm also going to do is I'm going to connect you to my colleagues across the hall or wherever we were set up so that you can begin working on XYZ. And we're all going to, maybe it's PTSD or something like that. And all of the clinicians, we're all going to work with you and we'll meet with you if you want to all together so that you can, get the benefit you need, get the help you need to overcome this pain, to become living, get to the point where you're living as much of an active life as you're able and willing to. And we might mess up a little bit. We might make a mistake here or there. But what I want from you, the patient, is to take an active part, to let us know, to give us feedback so that if we're not on the right track, we can switch gears, we can pivot, we can do what we need to do so that you feel like you're getting the benefit and the help that you need in this area of your life. And just a little conversation like that, like that's not anything super profound. Like I wasn't dropping mega knowledge bombs around, chronic pain or the, central sensitization and what we're going to do there. I just had a real, frank and honest conversation with them. Told, I was a little vulnerable about it. Listen, like I'm probably going to make a mistake here. I will probably not get everything 100%. But what I can promise you is that if you come to the table and actively engage with me in this, and you actively take a role in giving me feedback and letting me know what's working and what's not working, what you'd like to see, what you think you need, we will work with you to make sure that we're getting you to where you need to go. Now, a lot of times, working at the VA was wonderful in that we didn't have to worry about the insurance piece, so we could have team meetings and a lot of stuff that I know, especially now as a private practice owner, that just aren't practical when in an insurance-based world or in a fee-for-service world, which hopefully we're going to be moving more towards value-based care, and we'll be able to do a little bit more of that. So there are some limitations there, but at the very least, if you make that relationship or make that statement, come to the table, if you would, with that kind of attitude, the patients will become more engaged because they're going to see that you actually care, that your organization really cares about them as an individual, and you're not just running them through the mill. So anyways, those are just some thoughts about building that relationship and practicing the empathy piece, but then also removing the barriers. I think, again, when I think about it now, and if and when I write the second book, which I'm tentatively calling Bottom Up Healthcare, we'll see if I get the time between now and the 5 kids in my life and and work to get around to writing it. The piece that I think was missing in a lot of the conversations around building relationships with patients and empathy and the therapeutic alliance or the patient relationship and all that, the piece that I think is missing is how do we fit that within the process of care? I think a lot of times, even the interpersonal piece, you can train that, you can get that working more or less, where the clinician feels, is able to communicate empathetically, to show active listening, to build that relationship. But sometimes they're hampered or impeded by the way things are done, the process of care. So my idea with this bottom-up approach to healthcare is not just that we take a bottom-up approach in the actual patient relationship, in building the treatment plan around the patient, but really the actual process of delivering care should be built around each individual patient that encounters or comes into contact with our organization. Now, you might be thinking, man, that's crazy. How do we do that? But the reality is, this is where technology comes into place. Some of these tools, these platforms, these devices, these softwares make it so much easier for us to do that. So you have, I'm envisioning something like maybe you have a framework for the way you treat, chronic low back pain, for example. And, this framework kind of outlines your process, but how does it work for, Rafi Salazar coming into your clinic? Well, this is when the tools would come into place. And okay, we typically do this. These are the phases of the treatment cycle, if you would. And in this phase, I know in your particular situation, you do whatever the activity is. This tool will allow you to do this. This piece of technology will allow you to do this. Or will analyze your movement in this area and give us some feedback so we can modify it as needed so we can get things in place for you. Or you might have a question about XYZ. That's why we've got this secure messaging or this portal that you're able to shoot either a video or a message to us, and we're able to game plan with you. So it's not so much that you're like building everything from the ground up around each individual patient. You still have your framework. You still know what works, evidence-based protocols and all that. I get that. But you're using technology and the devices and the pieces in certain cases that you might not use this tool with patient A and patient B, but it's going to be very helpful for patient C, right? So I'm thinking of this, like my vision for this is that down the line, it's not so much that you have one device or one software. It's like a smorgasbord, if you would. And some of these devices are used with some are more appropriate with others, and you kind of tap in and out in order to develop a treatment plan for this individual that works for them, that builds the relationship, that is specific to their situation. Now, some of that, there's going to be some costs involved in that, sure. And I think I'm super, super hopeful and optimistic that even 10 years ago, the technology that we have now would have been 15 times, 20 times more expensive 10 years ago, or maybe even unfathomable 10 years ago. And now it's here and it's relatively affordable. So I think we're at that slope, that hockey stick, if you would, where the amount of capabilities that we have is going super, super high. And the cost to deliver that is growing marginally in comparison. So I'm very hopeful that somebody somewhere is going to develop some sort of maybe it's an integration tool or something that allows a clinician to use multiple devices or softwares or platforms for different patients and kind of pick and choose in order to build an individualized treatment approach for each patient. But that may be down the line. So anyways, those are just some thoughts I have about patient engagement, or about technology, and really about removing the barriers and the friction that come up between patients and clinicians, specifically around building that relationship. Like, what can we do to build and facilitate that relationship between the patients and the clinicians? A lot of that is removing those barriers, and sometimes something as simple as a patient portal or something that improves the access of communication or streamlines the communication is really just goes a long way. So anyways, that's all I've got this week. If you like the show, head on over to iTunes, leave us a rating and review. It helps people find the show. And if you happen to be in the healthcare technology space, maybe you're an early stage company, or you've got a tool, a software, an app, and it's designed to help clinicians deliver a higher standard of care. You want to innovate healthcare to make it more human, and you want to position that software or technology to attract and to get it in the hands of the clinicians that would most benefit from using it and the patients that would most benefit from using it. Then I encourage you to check out the Market Penetration Roadmap. It's one of the things that we do here at RehabU. You can find that at strategy.rehabupracticesolutions.com. That's strategy, rehab.practicesolutions.com. And basically what we do is we help you align your technology, your software, your tool with your targeted healthcare stakeholders so that you're able to create a consistent message to drive business development strategy for that specific healthcare stakeholder. We've got a couple videos on the site talking about kind of the go-to-market strategy. What does it look like? How do you do it? A little bit about what's involved, how long the process usually takes, some reviews, all that kind of thing. You can go check that out at strategy.rehab.practicesolutions.com. Until the next time, folks, be safe, be healthy. I will talk to you then.
Thanks for listening to the Better Outcomes Show, where we explore the possibilities of a new healthcare. Our hope is that you walk away from each episode informed, equipped, and empowered to push the boundaries in your own practice or business. We want to give you the tools to help you build strong, long-lasting relationships with your patients and clients, helping meet their goals, improve their health, and achieve better outcomes. Learn more at www.rehab.practicesolutions.com. We'll catch you on the next episode.